Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today, I have this partogram quiz for you. Okay, comment on this partogram. Look to this paper. This is a partogram. And before we start, we will start from up down. First, the personal information for the woman. Second, the fetal well-being, this part. Third, the progress of labor, included in this part, cervical dilatation, head descent, uterine contraction. Then the medication given during labor, during the active stage of labor. Then the maternal well-being. Okay, so first is the personal information of the woman. Second is the fetal well-being, the form of fetal heart rate, molding, amniotic fluid, is it clear or bloody or meconium stain. Then this partition, this third partition is for the progress of labor and the uterine contraction, cervical dilatation, descent, and uterine contraction. Then this part for the medication given and the fluids given. Then this part for maternal being, including the pulse, blood pressure, temperature, urine output, and any significant proteinuria or acetone. Okay, at the end, after description of all this, we should say what is the method of delivery and why. And also we should comment on the doctor who did follow up for this case, if he did well or not. Okay, let's start. This part for personal information, including the name, Mrs. M, prime gravida. Okay, so we comment on the gravidity and the parity, hospital number, date of admission, time of admission, as seen here, 10 a.m., rupture of membrane, 13:30. Okay, this is the first part in the partogram, including the personal information. Why we comment on rupture of membrane in this part? Because it is very important. Okay, and to know how many hours passed since it was ruptured. Okay, then this partition is the fetal well-being, including fetal heart rate and the amniotic fluid. Is the amniotic membrane intact or ruptured? And if it is ruptured, is the amniotic fluid clear or bloody, stained, or meconium stained? Okay, and this line below it immediately is the molding. If there is any molding and which degree. If there is no molding, it's okay. If there is molding, we'll say 1 or 2 or 3 according to the degree of molding. Okay, so here in this case the fetal heart rate ranging between these two lines, so it is nearly within the normal at the start, at range of 140. Okay, then become 120, then lower down below the line. This line, lower line at 100 beat per minute, while the upper one at 160 per minute. Okay, exceeding this parameter, or 180, exceeding this parameter means either fetal tachycardia or fetal bradycardia, denoting fetal distress. Okay, So here there is drop the fetal heart rate up to reaching 70. So the baby in distress, severe bradycardia. Okay? Okay. Let us comment on the amniotic fluid. The membrane was intact in the first 4 hours, then ruptured, at which time after 4 hours nearly at 13:30. Okay, at 13:30. Okay, okay. So the membrane ruptured. What about the amniotic fluid? Is it clear? Yes, it was clear. C for clear. Okay. M for meconium, B for bloody. It was clear during follow-up until after nearly 10 hours from starting the active phase becomes a meconium stain. Okay, at which time at 19. This is for the hours, and each big square is 1 hour. So half a square or small square, half an hour, big square is 1 hour. So this is for hours, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, from the active stage. Okay, and this is for the time, 10, 11, 12, and so on. Okay, as we know, the patient admitted at 10 a.m. So it is written here 10. Okay, so the membrane was intact, then ruptured, then amniotic fluid was clear till nearly after 9 hours. It becomes meconium stained and maintained meconium. Okay. Okay. What about molding? Is there any molding? No, there is no molding. As you see here in this area, there is no evidence of any molding. Okay. Let us go to the next, which is the progress of labor from cervical dilatation and descent of the head and uterine contraction. We used to use letter X for cervical dilatation, as you see here. Follow me, please. This is the cervical dilatation moving like that, the curve. Okay, crossing the alert and the action line. There is no, at the first 4 hours, there is no cervical dilatation. There is arrest of dilatation the first 4 hours. Then there is protracted cervical dilatation. Slowly, the cervix from 4 centimeter up to 6 centimeter or 5 centimeter. Okay, then becomes 6 centimeter here. This part locked to the hours from 4 to 8 hours. So next 4 hours, only 1 centimeter in this 4 hours dilated. So started with arrest of dilatation, becomes protracted, only 1 centimeter in the following 4 hours, then arrest again. So what about this progress? It is bad, of course. Also, there is cross of alert line and also crossing of the action line. And we shouldn't allow this to happen. If just touching the action line, you should take an action. Okay? Like what? Like doing cesarean section, because there is no progress. Okay? So alert line crossing is alarming for you. Either you evaluate the case again. If the membrane intact, you can induce rupture of membrane. If there is weak contraction, you can start oxytocin infusion to induce strong uterine contractions, 3 to 4 per 10 minutes. Okay. So you should be alarmed if crossing alert. But if crossing the action line, should take a decision immediately. But here, as you see, there is waiting in the follow-up, crossing the action line, and the doctor did nothing, waiting another 4 hours, then the decision was taken by doing caesarean section. What about the head descent? Head descent, we use letter O, this part. If we used the rule of fifths by abdominal examination, 5 parts of the head is felt abdominally. Okay, this means the head is floating. The head not even descend partially in the pelvis. There is no descent in the pelvis in the head, because all fifth part of the head can be felt abdominally. After 4 hours, the same, there is a rest of descent of the fetal head. After another 4 hours, what happened? There is no descent also, there is a rest. After another 4 hours, there is, what happened? There is mild descent. So only 3/5 of the head is felt abdominal, also not engaged. Because we know that engagement happens when only 2/5 or less of the head felt abdominally. But here, at this point, 3/5 of the head is felt. So there was a rest of descent in the first 8 hours, then slow descent only, but the head is still not engaged. All this denoting that there is a problem. Okay? Okay. When you look to the cervical dilatation, the head descent, you should look to the uterine contraction. Is there is strong uterine contraction or not? How can I know from these scores? These scores, how many scores per 10 minutes? If there is 2 scores stable, dots like that, this means 2 contraction per 10 minutes. Okay? If only 1 square, as in this area, this is 1 contraction per 10 minutes. The normal or the average is 3 to 5 contraction per 10 minutes to be efficient. And there is another issue also. What is the duration of each contraction? If less than 20 seconds, it will be dots like this. You will put dots or stippled like this. If continue between 20 to 40 seconds, you will make the square striped lines. If it continue from 40 to 60 seconds, and this is the efficient one, you will do coloration of the square completely. So dots means less, as in this partogram, dots means less than 20 seconds. Is it efficient? No, it is not efficient, of course. How many contraction per 10 minutes? Started with 2 contraction per 10 minutes, then becomes 1. So it's not efficient at all. Okay? Then again becomes 2 contraction per 10 minutes. At the end, it was 3 contraction per 10 minutes, but it is not efficient as regards the duration, because as you see here, it is less than 20 seconds. Okay? Okay. Is the doctor give any oxytocin to augment labor? In this area, you will write. There is no oxytocin infusion given here. Okay? Is it right? No. There is no good contraction. The doctor, after crossing the alert line, you should start oxytocin infusion to induce a good efficient uterine contraction. Good efficient uterine contraction may augment labor, may make the cervical dilatation better and head descent better. But he didn't give the patient oxytocin at all because there is nothing written here. So there is no oxytocin. If oxytocin is given, the dose should be mentioned and how many drops per minute. Okay? So, one of the points in this following the progress of labor, that there is lag of interference or even no interference. The doctor should interfere at this point after crossing the alert line, because all cervical dilatation should happen to the left side of the alert line. We crossed already the alert line and crossed the action line. Without any change in uterine contraction, even the contraction becomes weaker, then increase the little bit to 2 contractions per 10 minutes, but lasting 20 seconds or less. So it is not efficient at all. Okay? I hope it is clear for you. Okay? If I am doing follow-up for this case, I should augment labor with oxytocin infusion. Here, in this time, before reaching the action line. But after reaching the action line, you should take a decision, because there is a rest in the progressive labor. But here, as you see, the doctor waited too long time to take a decision to do cesarean section, and this is considered false, okay, or not doing well in this case. Also, there is severe bradycardia, so the baby was at rest. So there is fetal distress and meconium stain, amniotic fluid, all this denoting severe fetal distress, together with protracted cervical dilatation and descent. Okay, of course, this is for cesarean section. But you should give the chance for the patient for vaginal delivery by giving oxytocin infusion to augment labor and to have strong uterine contraction, then decide if there is any progress. If the cervical dilatation doing well, you can continue. But here, he didn't give oxytocin infusion, just follow up for the case, crossed the action line. He should take a decision for cesarean section, but he didn't. He waited another 4 hours and then did cesarean section while the baby was in distress. Okay? Okay. In this partition, the medication given during active stage of labor and fluids, intravenous fluids. Okay? Here there is glucose 5%, 500 milli, only given to the patient, nothing else, no analgesia, no other drugs. Okay? Okay. Let us go to the next part here. This part, as I said before, for maternal well-being, pulse and the blood pressure. Pulse was normal, about 90 and 80. No problem with the pulse. As regards the blood pressure, this arrow, double-headed arrow, the upper head for systole and the lower head for diastole. So she started with 110 over 70, then becomes 120 over 70, within normal. Okay? So we commented here on the pulse and the blood pressure, systole and diastole. In this part, also related to the maternal being, the temperature of the woman 37, so it is normal. What about urine? As regard the urine volume and proteinuria or acetone, the volume of urine at the start 300, then 200, so is it normal? Any proteinuria? No, negative. Any acetone in urine? No, so it is negative here. So as regard the urine character is normal. Pulse and blood pressure was normal and temperature is normal. Okay, this is the comment. What is the end result of this follow-up of labor and partogram. The woman delivered by cesarean section. You should write it on the partogram like this one. So when I ask you what is the mode of delivery, you will say cesarean section at 21:20 resulted in living female infant weighing 2,650 gram. Okay, so this is the end result. The baby weight is okay, an average, and the method of delivery is cesarean. So when I ask you what is the method of delivery, it's cesarean section. Why cesarean section? Because there is acute fetal distress, bradycardia, and meconium stained amniotic fluid, and lack or retracted cervical dilatation and head descent. So failure to progress with acute fetal distress. This is the indication here of cesarean section. Okay? Okay. Is the doctor did well in this follow-up, in this partogram? I said during analysis, he didn't do well because when the cervical dilatation cross the alert line, this is an alarming for the doctor or midwife who do follow-up for the woman in labor. And you should see if there is good uterine contraction. You should do observation for how many contractions per minute, and each contraction continue how many seconds. If there is no efficient uterine contraction, you should augment labor by either rupture of membrane, then augmentation by oxytocin infusion, and see if there is progress of cervical dilatation and the head descent or not. If there is no progress, you will do cesarean section if crossing the actual line immediately. Okay? But here, the doctor didn't interfere after crossing the alert line and didn't interfere even after crossing the actual line. He didn't take an action, although I should do cesarean section after crossing the action here, the action line. He waited too long time to take a decision for cesarean section. This is the end of my comment on this partogram. I hope it was beneficial for you. Remember, we are commenting on personal information here in the upper part, then items related to fetal well-being, fetal heart rate, amniotic fluid, and molding. Then this partition for progressive labor, cervical dilatation, and descent of the head. This partition also for uterine contraction, how many contraction per 10 minutes, and what is the duration of each contraction. Then this is partition for oxytocin infusion. This is partition for medication given and the fluids given intravenous. And this lastly, this partition for maternal well-being, the pulse, the blood pressure, the temperature, the character of urine. This is the end of my comment in this quiz. Thank you, everybody. This is my published book on Amazon, textbook of obstetric, textbook of gynecology, contraception handbook, and the multiple choice question. This is my link on Amazon as a user, and this is my link on YouTube channel, and this is another scientific site belong to me. Thank you, everybody. Wish you the best.